This meeting was moved from being what we were planning, which was a hybrid meeting where some of us would be in person at the Millennium School and some of our panelists here from the two boards would be on Zoom. We changed that to be virtual only, mostly because the hybrid setup that we were using last week, we know it was causing problems audio wise. It was hard for Zoom attendees to hear, and we felt like it was really critical that everybody be able to hear everything that was being said. And so we went with this for this meeting. As a school committee, I can say our plan is to be back in Millennium for our regularly scheduled meeting next Monday, the 31st or 30th? 30th. Thank you. And we have possibly some new equipment that's going to help handle that hybrid meeting situation that we'll be trying out. So bear with us as we try to make these meetings as accessible and inclusive for people who want to be there in person and for people who cannot. And so thanks everybody for attending. We did try to get the word out today about the change to virtual. There's a sign up at Millennium for anybody who might be heading over there for the meeting. Apologies to those who didn't get the word. I know we pushed out a message over the Blackboard Connect system. The agenda got posted to the town website at some point today. And so hopefully everybody who wants to participate can participate. So appreciate everybody's patience on that. We are going to start with public comment, and it's going to be all virtual. And I already see a hand raised. So basically, what we're going to do is just like we would at a live meeting, we're going to allow public comment. We'll over Zoom, you can raise your hand. There should be a button to do that in your Zoom window that you can raise your hand. And what I can do then is allow you to talk and bring you in so we can see and hear you. We're going to try to get to as many people as we can. We have about just under 20 minutes allotted for this on the agenda. And in order to get to as many people as we can, I'm asking everybody to limit your remarks to 2 minutes. That's what we've been talking about. Is going to be our protocol this year, is 2 minutes per speaker. I'd also ask that if you spoke last week at our meeting in person, please let other people have a chance to make their public comment, especially if you were going to reiterate something that was said last week. Try to let new people speak. And if you are coming again, bringing new information or new perspective would be great. And I guess the last thing is for those who did not hear I think a lot of people are here because we're wondering what's going to happen this school year, especially with regard to masks. And so for those who might not have heard, on Friday, the Commissioner of Education for Massachusetts asked the Board of Elementary and Secondary Education, he requested that they vote to authorize him to institute a mask mandate for all K-12 schools in Massachusetts. And that would be a mandate that would go through October 1st. And at that point, it would get reevaluated to see the efficacy and advisability of that continuing past October 1st. And so the late breaking news is this morning, the Board of Elementary and Secondary Education did in fact meet, and they did in fact vote 9-1 to authorize the commissioner to institute that mask mandate. So what that means for us is it looks like that will be coming from the state level, that mandated masking in K-12. Tonight, we will be talking about that somewhat, but possibly other recommended measures that we might look at for Westford schools. And the Board of Health, since this is a joint meeting with the Board of Health, they will be just discussing not only things that they would recommend for the schools, but possibly for the wider town buildings as well. So with that, let's kick off public comment. It's 7:06, or a few minutes late getting that started. And I have somebody with their hand raised. I'm gonna bring you in, Bill, as a panelist. Once you're in, you can start your comment. Welcome.
Hi, thank you. Bill Bellotta on 52 Nottingham Road. Not so sure if we're supposed to do that, but thank you for all your time. I know this has definitely been a difficult period for everybody. I'm definitely one of those that thinks we probably should have a mask mandate. Just, we need to protect the vulnerable. That's what I believe. But one thing I'd like to hear tonight is the absence policy. Just because of things I'm hearing from other towns, and I apologize for that. I'm not sure if I say that, but what happens if, my son has to quarantine 4 different times? What's the absence policy going to look like? How is that going to work? I'll keep it brief. That was my big thing. Thank you again for all your time, and I can waive the rest of my time.
Okay, appreciate that. Yeah, thank you for starting with your name and your address. I missed that, so we are asking people to do that. And thanks for the good question on absence policy. Let's make sure when we get to our discussion that we touch on that. Okay. Thanks, Bill. Now let's bring in Wendy. Okay, Wendy, you have the floor. If you can unmute yourself. There you go.
Okay, good. Sorry about that. My name is Wendy Welsh, and I live on Tech Valley Drive, and I just want to say that I'm against these mandates. So there was some research that I found, like the aim of this research was to find, test, evaluate, and compile scientifically proven related side effects of wearing masks. For quantitative evaluation, 44 mostly experimental studies were referenced, and for a substantive evaluation, 65 publications were found. The literature revealed relevant adverse effects of masks in numerous disciplines. In this paper, we refer to the psychological and physical deterioration, as well as multiple symptoms described because of their consistent, recurrent, and uniform presentation from different disciplines. That's just obviously using lots and lots of studies and publications. Another thing that I found was so the study published by the CDC was both ambitious and groundbreaking. It covered more than, so this is something else. It covered more than 90,000 elementary school students in 169 Georgia schools from November 16th to December 11th. And it found that masking children was unnecessary. So let me tell you how I first started. I started at UMass. A guy stopped me for a signature, and he said, "This is a petition to stop the US government from taking down democratically elected governments in South America." And I thought, this guy's crazy. The news would tell me. And then I saw Noam Chomsky gave a lecture. He said the same thing. I took a political science class at UMass, and they said that they were right about this. But we were never told this. So what we were told, what was happening, was so different from what actually was happening. Now, after that, I went to Germany. And so 3 Spaniards came up to me in my class and asked me why we were bombing democratically elected governments.
Wendy, sorry, your time, we've hit 2 minutes, so if you could just conclude, please.
Yeah, sure. So what I'm saying is that what they know in Europe, when I was in Germany, the Germans knew what was going on because I was studying there. And now they are now still knowing. So if you can look, you've got here the French, they are in the street saying no vaccines. These are the people in Greece. There are the French, the Germans.
I'm sorry, we're going to have to move on to the next comment.
I'm just saying that we need to know,
Thank you, Wendy. I'm gonna go to the next person now. Thank you, Wendy.
Give me one more second, please.
Sorry, we need to hold people to equitable time periods, folks. It's unfair to give somebody more time. Let's bring in Melissa, please. Hi, Melissa.
Hi. Thank you, Melissa Mackey, 12 Fletcher Road. So I want to thank the school committee and superintendent and the Board of Health for reading and answering so many emails from myself and the rest of the community. My concerns for masking is on the potential for developmental impact to our youngest learners and our special needs community, both of which I have in my home. Kids have a wide range of needs, socially, emotionally, developmentally. And what works for adults doesn't always work for children. I think little kids need to see faces to learn language skills, read emotions, interpret social situations. And our special needs community, who already struggle in the typical school environment, masking potentially compounds an already difficult journey. We have seen that Europe has a much different dialogue regarding masking in children. Their CDC does not recommend masking for students under 12. Other European countries, including the UK, have exempted young children from wearing masks because of the social and emotional development of young children. And the World Health Organization explicitly states that the decision to mask students carries with it potential and academic and social harms. But here in America, this conversation is very different. It centers completely on COVID without acknowledgement that every layer of mitigation comes with a trade-off to our children's overall development. So I think it would be a simplification to say that masking is completely harmless. I think we have a responsibility to our children to ask and answer a very difficult question. What is the potential risk of these long-term mask wearing to our kids? Thank you.
Thank you, Melissa. Okay, I'm going to bring in Eileen. Hi, Eileen. You have the floor.
Hello. Thank you. Thank you for bringing me on in. So I'm Eileen Tatro. I'm at 15 Oak Road and my pronouns are she and her. And I wanted to, first of all, say thank you, all of you, for very seriously taking into account our most at-risk students, teachers, and staff. I know that this is coming down from, a higher level, but I definitely appreciate that you're looking at across the board at those with health issues, as well as, other disabilities and other issues. I do have a question. I know I sent the email to Dr. Chu and to the school committee, specifically asking about those students who are unfortunate or unlucky enough to be out for a longer period of time. As we keep hearing about long COVID. These things can last for a while. They can cause significant issues. And one of my major concerns is how students what the plan is for students to come back and get back up to speed. I know WA used to have a bridge program for similar sorts of issues. I don't know if they're still in place, but the other schools do not. And I definitely think that, that consideration is something, even just having it as a background plan can benefit not just for COVID, but students who are out for a longer term for other reasons, whether it's mental health or physical health. Thank you.
Thank you. And yeah, we'll try to touch on that when we discuss under our old business agenda item. Thanks. Okay, Eileen, you're heading back to attendee land, and we're going to bring in our next public commenter, Michael. Hi, Michael. You can go ahead when you're ready.
Hi, everybody. Appreciate the time. Michael Ryan, Road and Assets. I appreciate the people before me to have the courage to come speak in such a forum. It's an important thing that's unfound these days. I too am a non-masker for my daughter, and I'm going to tell you why. If you just take it down to the bottom bare level minimum, I just had 3 girls, 3 friends running around all over Westford, no mask anywhere. We went to a restaurant, we went everywhere. What you're telling a child when they get on that bus is put on a mask, Go sit in that mask for 7 hours a day, get on the bus, come back, take it off, and then go back to the rest of the world. Like nothing's happening. Currently in Westford, Massachusetts, there's 10 cases. 3 of the cases live together. You can see that in the public health home data. There's 7 other individuals. The youngest is 18, doesn't qualify. Currently, today, 0 children in Westford have COVID. The non-maskers, and whatever, we're not trying to hurt it, but we're trying to, my own daughter, when it came to April, last April, their own numbers, when the rest of the state of Massachusetts went back to normal, it was like 80 cases per 100,000. Today, the own data, cases, very important, is like 17 per 100,000. So in April was fine. Schools opened up fine. We went on a business. Everything was cured. Joe fixed it, right? Today, forward, months later, we're only at like what, 20% ballpark numbers of those numbers. And what we're saying is, children, put on a mask because you're killing people. And that's just not the truth. My own daughter, last year in April, I had to force her. She was terrified, shaking. I need my mask. I need my mask. I'm like, honey, put your mask down. We'll walk inside. Look, nobody's got a mask on. It's fine. That's it. Thanks for your time.
Thank you. Okay. Our next public speaker I'm bringing in. Hello, go ahead when you're ready.
Hi, Chris. Good evening, everyone, and thank you for inviting. I believe in science, and also I work in the healthcare profession. So I do understand the reason behind mask and vaccination both. And while we are mandating masks, my second apprehension here is now that the Pfizer vaccine has been mandated for children above 12, would we consider mandating the vaccination for children as well? In fact, I would propose we do mandate vaccination because it's important that we protect our children and ourselves. Thank you.
Thank you. And I'm looking at the clock, and I'm going to let in, there are 5 people waiting right now with their hands raised. We're going to do those 5, and then we're going to cut it off there. Hi, Sarah, you're on. And again, just a reminder for folks to please say your name and your street address. Thank you. Sarah, are you ready?
Am I here?
Yes.
I am here. Hi, I'm Sarah Kazari. I'm at 2 Doris Road. And I'm very angry that this meeting wasn't last night before all this stuff was mandated, but I wrote a little thing that I feel like I just want to read anyways, if you don't mind. So I find masking our children very harmful to them in so many ways. Not being able to breathe freely is not healthy. It affects them socially. Not only can they not see their friends' faces, but they cannot see their teachers' faces. How are they to learn letters, sounds, and words properly when they can't even see their teacher's face? Never mind everything they do hear being muffled. And in a matter of the germs on the mask, someone had mentioned it's a mask, it's to touch your face and nothing else. My response to that is, are you kidding me? It's hard for me not to touch mine sometimes, never mind a preschooler, 1st or 2nd grader. And I have a child with me. Oh, of course, when it's my turn.
And we take all forms of public comment.
So in the matter of how the germs get on and they take it off and on at recess and lunch and they put it back on, and there's food and sweat and saliva. And I don't understand how anyone could possibly think it does not get germ infested throughout the day. And in regards to the ordering the mandate, I know it wasn't you guys that ordered the mandate, but I don't believe it's anyone's job to order a mandate on our children. For that matter, the commissioner to be able to veto any decision made by any town, and him seeking the authorization means he never had it in the first place. And that was probably for a reason. I find it a very, very big overreach for him to have taken any voice away from any school committee, any town, any parent over our children in our own towns. And a blanket policy, especially with the numbers in our town being so low, just doesn't work. I feel it should be left up to all the individual parents to make a decision for their own children, whether it's right for them to wear a mask or not. I prefer not to wear a mask, but I'm for anybody that would love to wear a mask, they can wear them. We've never had a mask mandate before for any illness ever in the school. And they've been around for hundreds and hundreds of years, and everyone has been fine. And people have died, and I understand people have died, but the problem is we don't know what people have died from COVID or with COVID. Even on the CDC's own website, they
Sorry, just
lump
want to let you know we're over 2 minutes, so if we could just wrap it up. Thank you.
Well, my last little thing is, can anybody tell me what the end game is with COVID? And are we waiting for 0 cases? Because I feel as us, all of us as parents sit on our hands and do nothing, it could quite possibly go on forever. And I do believe COVID's real, and I do believe it can be dangerous or deadly to some, but I'm struggling to see where this ends. And at some point, I would like to be able to get back to our lives as we live normally. Thank you.
Thank you, sir. Hello. Good evening.
Hello, good evening. I'm Supriya. I'm from Indian Ridge Terrace, Graniteville community. So we just recently moved to the Westford area, and this is the first time my daughter will be going to the day school in person for the coming year. She's in elementary school grade. So my question is regarding the opportunity to have like a virtual setting for the coming school year for the 21-22. At least for the kids or with issues, or for the parents who are not comfortable in sending the kids back to school. Because compared to this time last year, the case count, the hospitalization rate, the infectivity rate, everything has increased compared to the same August of 2020 to 2021. And the children infectious rate was also increased compared to the last year. So what has changed, which is asking or which made the mandate that there is no option for remote learning and it should be completely in person? Because everything except death rate, everything looks worsening compared to this time last year. So that's my question is there any chance for the parents who are not comfortable in sending the kids back to school an opportunity for remote learning? Thank you so much for the opportunity.
Thank you. And I'm going to give the short answer, but we can get into it a little bit more. But I believe the short answer is the state is not allowing that this year, a full virtual remote schooling option. And I think as we get into our discussion, I think Dr. Chu could probably speak further to that. But
Okay.
Thank you for the question.
Thank you.
Okay, we got a couple more to get to. Thanks for everybody's patience. It takes a little time to get people transitioned in as panelists. Appreciate it. And thanks to everybody coming out and giving your public comment. Hi, Erin. Erin, you're muted.
Sorry about that. Yes, sorry, Erin Heinold from 49 Hilder Street. I wasn't planning on saying anything tonight. I saw this was on the last minute, but when I was seeing some of the other commenters, I just want to express my appreciation for all of you for doing the hard work. Yay, masks. And my children are now grown, but if my children were school aged, I would want a virtual option, or I would be taking them out. So I think that I'm kind of tired of the loud voices, which are very, very much in the minority, getting all of the airtime and all of the space and all of the time. And I just want to say, yeah, and if anything, I think is the health board also here tonight. Did I see that? if we could get all indoor spaces in Westford, including and especially, please God, gyms, to have also a mask mandate, I would love that. That's what I really want. So gyms, masks, yes. And a vaccine mandate and virtual, also great. Because the schools do affect the community, and Delta is really affecting children. I think you all know this. But yeah, anyway, I will sit down now. I think you guys all know the science. I don't need to say it. Anyway, thanks for the great work.
Thank you, Aaron. Hi, David, you're on.
Hey, thanks, team. Just a couple of quick things tonight. Appreciate the opportunity to speak. Just hoping that the team can talk about remaining mitigations in school and what mitigations other than masks. We seem to be focused, primarily on masks, but there's a lot of other mitigations that were put in place last year. And I'd like for it to be on record what is remaining outside of masking. And then secondly, DESE came forward obviously yesterday or today with the mask mandate. And we all know that at some point that's going to change, right? So we were going to vote on that tonight ourselves as a community, but that's going to change at some point. And I really challenge us to pull together data and metrics on right now, not wait for when DESE makes a change. We should be planning for what our off ramps are right now so that when DESE makes a change, we're ready to make a change. And either align with them or align to something else that we feel as a community is what we want to do. So I challenge you guys to continue this discussion, to leverage the community to have this discussion, and to not wait and sit on our hands for some new guidance and then for everyone to get up in arms again. But I don't align with that guidance. Let's create Westford guidance now. So when it's our turn to make the decision, we can make the decision. Thank you.
Thank you, David. And just as a side note, for those who stick around for the rest of our meeting, we'll be talking about next our new policy, which does look at that. It gives us a mechanism by which we can implement measures, not wait for the state. And the superintendent, we'll talk more about it, superintendent pulling in data from multiple sources, looking at local conditions, can recommend mitigation strategies. And to your other question, David, we will be talking about other mitigation approaches as well in our upcoming business. Okay, this is our last public commenter. This is the fifth and final one that we had in the queue when I said we were going to cut off the line. So welcome, Brendan, and you have the floor.
Hi, I'm not sure why. I'm trying to get my video on, but I'm not. So, oh, there we go. Sorry about that. My name is Marcia Gilmore. I'm at 7 Magnolia Drive, and I wanted to thank you all for working really hard. As far as the mask decision goes, of course, we don't want our kids to have to wear masks, but the point is keeping our community healthy and keeping our children healthy. And it's the CDC is recommending it. The Mass Teacher Association is recommending it. The US Secretary of Education is recommending it. All you have to do is look at the numbers. In June, it was a different story, but the numbers have, I think, increased immensely. There are children that are going into the hospital now. I mean, there's just, I was going to rattle off a bunch of numbers for you, but you probably know the numbers, and I understand. I taught this past year, kids were wearing masks and they were okay. The kids, I get used to it. My kids got used to it. And there are clear masks where for kids who are learning speech, teachers can wear those clear masks and see your mouth. And I understand there are certain kids with certain disabilities or certain issues that wouldn't need to, that shouldn't have to wear masks. And there are already exceptions. But my real question for you is beyond the masks, distancing for lunch, because if we're not distancing for lunch, then that's going to be an issue with the masking. So I'm wondering how you're going to do that. What types of filtration are we improving that to help? And I thank you all for your hard work. I know it's not easy. I know nobody wants this, but unfortunately it's not over. And from having losses in my own family, my husband's mother dying, my cousin's still sick from a year who was young, and it's real. And I think people need to know that. And of course, yes, there's a cost with masks, but there's a bigger cost right now not to wear masks. Anyway, that's all.
Thank you, Marcia. Okay, and that ends our public comment. I really appreciate everybody coming out and speaking your mind tonight. And as you know, we take this very seriously, and we're continuing to work with Board of Health and the superintendent. And it's not just tonight, and it's not just, you know, what the state is mandating. We're going to continue to look at taking the best actions we can for the safety and the well-being of our students and our families. And I know everyone shares those sentiments, so appreciate that. And with that, we're going to move on to next agenda item, old business. And it's old business, but it's our new policy. And I'm going to, I think I'm going to screen share it, if folks like that. So as you may recall, if you were here last week or at Millennium last week, this is a new policy that provides a mechanism by which the superintendent and the school committee can enact various health protocols in response to emergent health situations. And so we had our first reading of this policy at our meeting last week. We had a public comment period that lasted, I think, about 6 days. We received a number of comments, I think maybe in the 30s. I'd have to go back and look. And the policy subcommittee met yesterday. We did look at all of the comments, and it was really helpful. I want to thank people who took the time to read the policy, to read the document that gives sort of the justification for the policy, and to make comment. And it did make a difference. Once again, I say, you know, the public comment can make a difference. It did here. And so we appreciate that. What you see on your screen now are a few changes that came between last meeting and today. These are the changes that the policy subcommittee put in. And just quickly, you know, there's one that's just here. It's just putting in a, you know, an acronym to be consistent with our other acronyms here. We specified that authorization would be given for any measures by a majority vote of the committee, just to specify that it doesn't require a 2/3 vote. Majority vote is the default on most of our votes. And then this last paragraph, which you can read if you like, this was put in, the question was raised, you know, the policy above talks about the superintendent would bring his or her recommendation to the school committee, and the school committee would approve that. And the question was raised, what happens if there's really an emergent situation, an urgent situation that happens outside, you know, a convenient window for the school committee that needs to be acted on sooner. And so this last paragraph addresses that in saying that the superintendent, you know, in consultation with local health and emergency authorities, can put into place temporary safety measures. And then what would happen at that point was he would notify the, you know, the school committee, parents, staff at the appropriate location. And then at the next school committee meeting, the superintendent would then either recommend that those measures need to continue, or if not, they would just end at that point. So they really would be temporary measures just to get us to the next school committee meeting, at which point everything above this paragraph would apply as far as making this something that extends beyond just that emergency temporary period. And our meetings are 2 weeks apart if necessary, and it felt like it couldn't wait a week and a half or a week or whatever it would be to the next meeting, we could call an emergency school committee meeting to address the situation. And so that was something that was raised by a number of people, and we felt it was important to really round out this policy, which we we like because it gives a lot of flexibility to how we approach things. But this did seem to be a missing piece to handle that particular situation. And so that's how that ended up getting in there. I want to open it up to see first if Valerie and Alicia, who worked on this policy from the policy subcommittee point of view, had any additional comments, anything that you feel like we should say that I did not say.
This is Valerie. I think you covered it all. You know, we did read through all the feedback, and even if a change wasn't made, we discussed it in the subcommittee meeting. So I think that's really important for the public to know. That's it.
So I would also just add that there was a question raised about students with disabilities and staff even that may need certain accommodations. And there was a question about whether or not we should outline in the policy how those accommodations would be made. We did not choose to do that because the policy is not the place for that. However, you would follow your standard operating procedure where if you felt like you needed something addressed, you would go to your team, you would go to your teacher, you would go to, in the case of staff, you would go to your building principal. So the general process for addressing concerns for special needs students, you would follow the same process. That was not outlined in the policy because that doesn't belong in policy, that belongs in a team meeting.
Sorry, Chris, I thought of one more thing that we discussed in the subcommittee that I think is worth reiterating. You know, there were some feedback about, is this too much power? Like just questions about the authority and stuff. And I thought we had a really good discussion during the subcommittee about that this doesn't happen in a bubble, right? Like all of these would happen at public meetings. So that's the kind of check and balance that would be inherent in the process.
Thank you. I think that's a great point. Gloria, you have your hand raised.
Thanks, Chris. I just wanted to say thank you to the policy subcommittee for putting this together so quickly so that we would be in appropriate compliance for the start of the school year to have this policy in place. I think people should keep in mind that this policy is not intended as a COVID mask policy, and that is all. This policy is kind of was intentionally designed and written to cover a variety of public health situations, whether it was a MRSA outbreak at the high school or the situation we're in right now with COVID. This is a policy that can live on after this pandemic and can be called upon and utilized to keep our kids in school and to keep schools open and to keep kids and staff and the community at large safe during a public health emergency. So I commend the policy subcommittee for putting this together. I appreciate all of the public comment that was received. And the last comment I'll make is that I think this policy does do a good job of supporting the superintendent's responsibility to protect the health and safety of students and staff. And it balances that with lots of public notice and committee oversight. And I think it strikes an excellent balance, which works to the advantage of our students and keeping them in school. The last comment is a procedural one, Chris. I know people are already kind of commenting on it, but we should take a procedural vote to waive the second reading before we take the vote on the policy.
Are you making a motion?
I can do that now or later. I know people were already making comments, so it's kind of your call about when to do it, but sure, I will make
we do it before we forget to do it.
Okay, motion to waive the second reading of the policy.
And I will second that. So we're going to do a roll call vote of the school committee. Valerie?
Aye.
Catherine?
Aye.
Alicia,
Aye.
Gloria,
Aye.
and Sean.
Aye.
And I'm an aye, so that's a unanimous vote to waive the second reading. Thank you, Gloria. Other comments? And just be, I don't see any comments yet, but I was going to say, I know we talked about this at policy. I think we voted, so I should have gone back and checked, but I think we voted at the last meeting. We voted to deviate from our usual policy procedure, given what we felt like was an important timeline that we stick to have this policy in place for this meeting. And that took a 2/3 vote to deviate from our normal process. And for those who maybe didn't see that, we usually would introduce a policy and have a first reading. We would leave it up on the district website for public comment for at least 12 days, have a meeting in between where we discuss comments we received, and then at a third meeting, do a second reading of the policy and vote to adopt the policy. I believe we voted last week to deviate from that. I know we had some discussion at policy yesterday, like, did we just deviate on the time period that it was on the website, or did we deviate, or did we vote to deviate from the whole process and shorten it to 2 meetings? My recollection was that the sense was that we were just voting that one time to deviate from the entire process and that we don't need any additional votes today, but I am open to other people's interpretation and recollection of that as well. But that's where that was my recollection, that we're okay, that we already voted, that we would do this on a shortened timeline and take a vote tonight. So I'll take comments on that, or again, on the policy. Okay. So hearing none, I would, oh, the other thing I should have mentioned as we were looking at the policy, I think we're still screen sharing. We did modify the name just a bit to make it perhaps a little more descriptive and clear. Move that we adopt policy P5517, public health emergency protocol authorization.
Second.
Okay, that's a second.
Chris, I think we have a hand raised and the superintendent.
Oh, I am sorry, Dr. Chu. Yes.
Thank you. I was just going to chime in only because you forget that in this Zoom, if depending on the gallery view or not gallery view, people might not see people nodding their heads in agreement. So as you were talking about it, I just did want to just say publicly that I appreciated the work that the policy subcommittee put together in creating this. We did discuss it at the last meeting in person, and I know that last paragraph, I appreciate that additional language there, because that was something that we had talked about. And I think it is clear that there's still checks and balances to what Valerie had suggested as well too, that it's still, it still requires me to consult with other people, but in an emergency situation, in an urgent situation, it allows me to not have to rely on a regular scheduled meeting. So I just wanted to publicly say that I appreciate that, and I'm in full support of this.
Thank you for that. So we have a motion and a second. Any further discussion or questions? Seeing none, I'll call for the vote. Valerie?
Aye.
Catherine?
Aye.
Gloria?
Aye.
Sean?
Aye.
Alicia?
Aye.
And I'm an aye. So that's a unanimous vote to pass that, to adopt that new policy. And yeah, my thanks to everybody who gave input and who had a say or a hand in putting this through. I think it's an important one that we'll be glad we had in the future. So moving on to our 7:30 agenda item, we're close, we're not too far off that, updated COVID metrics. So at this point, I'm gonna hand off to Jeff Stevens and the Board of Health, and we're eager to hear updated metrics from you and any other thoughts or recommendations you folks have.
Hi, everyone. Thanks for having us on tonight. So I do have some updated metrics on where Westford actually stands tonight. I pulled this information off of the state reporting system known as Maven today at 4:30. I know we had a resident earlier that was calling out last week's numbers, and they have changed drastically from last week. Currently, there are 1,569 total cases that have occurred in Westford. 1,508 have recovered, which is great. But there are 34 active cases this week, and 27 have passed. The only positive note on that is the last time anybody in Westford has passed is, from my records, well before February. So that's good news. We haven't had to endure that locally. Within our 34 active cases, 15 came in yesterday and 8 came in today. And based off of what I can see in Maven, 6 of them are kids right now under the age of 18. And they range in age from 9 to 15. There are probably more that are going to populate in and over the next day or so, because sometimes we know about them before Maven populates them, which is, I think, the case this week. And that's where we kind of stand with our current numbers right now. Positive note is Westford still stands at least 75% of our available population is vaccinated, that can be vaccinated, which is great news. And there was some interesting information today that we got on our state call that kind of stuck out to me, that 30% of, as many as 30% of hospitalized people right now actually are vaccinated, but the state does admit that number may be skewed a little bit because they pay very close attention to that number for breakthrough cases, as opposed to people that are unvaccinated, and how many of them there are. So they're watching that number very closely. A couple other numbers that pointed out today that were interesting. The unvaccinated people were 30 times more likely to get COVID, and 4 times more likely to die from getting COVID, which kind of is a sobering number when you think about, if you actually do get it, your risk goes up significantly. Within masking in schools, I know I was asked to look at what communities have already agreed to wear masks at the start of the school year, and nearly all of our local neighbors that I've reached out to have already made that decision to do so, which includes Chelmsford and Lowell, Billerica, Dracut. I'm waiting to hear from Acton, which I haven't heard yet. Groton is going to do it. I know in different parts of the state, many are already making that choice to do so, and many are making the choice tonight. So we'll hear more as the next day or so goes by. I think Commissioner Riley may have taken that out of our hands at this point on making that vote, which I think we all agree with. And that's kind of my report on what I have for local numbers tonight, and I'm happy to try to answer any questions I can. And we've got staff on, and Ray Dick and Gail Johnson, that can also help answer questions. Gail's dealing directly with cases, and Ray is also helping out and transitioning into the director's role.
Great. I didn't know if Board of Health, do you folks want to chime in at this point, or do you want to, I don't know if you have any comments at this point, or if we can go to, we have a hand raised from a committee member. Zach, you have your hand raised. I want to give a Board of Health person a chance here, and then Catherine, we'll get to your question.
Thank you, Chris. Thank you, Chris. Yeah, I just wanted to give a quick update to everybody. I did a little research over the past week or so. There are 250 air purifiers that the town acquired. They're the Filter Queen 4000 Defender, which is a great model, actually. Those are being placed in rooms throughout most of the schools that don't have access to windows. And they've been, you've probably seen them in the schools. They've been there for about a year. My only recommendation would be, they are expensive units. So I'm estimating that probably costs about $200,000 for those 250 units. My only recommendation would be that we consider getting more This is a unit that actually filters air down to 0.1 microns, which is actually smaller than the virus. So it's a great way to not only make people feel better, but to actually filter the air. It does about 2 to 3 to 4 air filterings per hour, depending on the size of the room. And so it's a great way to make sure that we've got that virus in a low number, if there is any, in the schools. So just throwing that out there, I don't know if this is the kind of thing where, parents can pitch in and help to purchase units, or if this is something where there might be some more CARES Act money available. But I'm really glad to see that town's already done it. And if we can get more of them, it can only help. Thank you.
Great point. Thanks, Zach. Catherine?
Thanks, Chris. Jeff, I just wanted to come back and ask, you were talking about the active cases at the moment, particularly 15 yesterday, 8 of today. Could you talk just a little bit about, if you know, where these cases are contracting the COVID-19 from? Is it through travel, partying, work, home, etc.?
Well, generally, we have seen throughout the summer that a lot of these cases have been through travel. Without getting into too many details, which we can't really do in this current case of 15, it's maybe a slightly different situation where there's a little bit of a cluster going on. And it does come down to people needing to know if you're feeling okay, or if you're feeling sick, you need to stay home. So that's what's occurred here. But this is how outbreaks occur, when people are not well and they go into crowds and outbreaks occur. So it happened at the Cape, which was obviously, we all saw, which was a pretty good size outbreak that spread very quickly. And this is an outbreak that hopefully doesn't travel too far, and it's contained quickly because we got the information as fast as we could get it, and we don't see it travel much further than it is. So yeah, right now we know the Delta variant is widespread throughout the Commonwealth. We know it's the dominant strain, and it is highly contagious.
Sean, a question?
Thanks, Chris. My question's actually related to, I think it's the third bullet item that we're doing, Chris, that has to do with the testing protocols. So are we going to have the Board of Health here for that discussion, or is it appropriate?
Yeah, I imagine they'll stick around for that.
Okay, so I'll hold off then.
I hope. Please stick around for that. Okay, thanks. Zach, I don't know if your hand is still raised, or is this a new hand raising? Okay. Okay, no additional questions or comments. We do have on the agenda that the Board of Health. Oh, no, we do. No, there's a flurry. All right, Gloria.
Sorry, Chris. I wanted to confirm that I heard Jeff correctly, that there were 34 active cases now, and am I correct in understanding that that's in contrast to last week when it was only 10? Is
Yes.
that really the 1 week increase?
Yes.
And as of last week, none of them were in the children under 18, and now that's 6 and potentially going up.
So I don't have the last week's numbers in front of me, and Gail could comment on them because she's the one that pulled those numbers. But yesterday they were 15 cases, today they were 8. So in 2 days, 23 of those 34 cases showed up.
Thanks for clarifying.
It looks like, I'm looking at last week's, it looks like there was an 18-year-old in the 10 last week, but everyone else was over 18. Catherine? You're muted.
Sorry, I'm hitting all the wrong buttons here. Could I just ask, what are, I believe if I'm reading the numbers right, Middlesex County currently is considered high risk. What are the numbers for us to be considered, kind of at a lower risk in terms of numbers within Westford or within the county? Do we know that, or can you explain that to me? Apologies if it's a really simple question.
I don't think it's as easy to answer as I would like it to be. The state kind of sets what's high risk, and it's usually the percent positivity of what the community is testing. At times when our percent positive numbers have come in, we have actually tested, our percent positive for cases has been higher than the state average. It hasn't necessarily been more cases, but because less people are getting tested, and the people that are positive, that percent positive number looks slightly higher. So that's where I think the state's basing that number off of, on how they get there. They send us weekly testing data, which comes out on Wednesdays, usually get it around 4:30 in the afternoon.
And I'll just chime in too, because I've really looked a lot toward the CDC metric, which is new cases in 7 days per 100,000 residents. And so I've personally been tracking that in a spreadsheet. And so they, in their system, I think 0 to 25 new cases in the past 7 days per 100,000 is low, 25 to 50 is moderate, 50 to 75 is substantial, and 75 to 100 is high. And I can tell you, when I ran Westford's numbers, we kind of got that bump at the end of July, or through mid-July and early August, where we were seeing an increase in cases. We were above 50. We were even up to 80 something per 100. So we were in the high, even in Westford, for a while. I think the last couple of weeks, the numbers have been a little bit lower, but I'm guessing this bump, I'd have to see what it does to the numbers. That would put us probably back up into the high per CDC. And if you recall, the CDC recommends indoor masking, even for vaccinated folks, if you're in the substantial or high, so anything above 50. So we've pretty much been there consistently, except for maybe the 1 or 2 week, or I think 1 week dip last week. That's my armchair spreadsheet jockeying. Any other comments or questions from either committee or staff?
So I guess the only other thing that I would like to maybe bring up is I'm aware of what Commissioner Riley is in the process of doing. The board may want to consider making a recommendation for town buildings at this point, and I would just call it a recommendation at this point only for the select board and town management to make their choices on what they'd like to do with masking in buildings.
So I believe understanding was that sort of for consistency and given the way things have been trending, we were thinking to make a motion to request that all people wear masks in town buildings. Is that how we would say it?
Yeah, I think that could be formatted into a recommendation that says all employees and residents entering town buildings shall wear a mask, and the board can revisit that at their September meeting or October meeting if they so wish, to either change the recommendation to a town order, or leave it as a recommendation, or relax that if data so suggests.
And we wanted to probably put a caveat in that in their private offices, masks would not be required as previously.
Yes, I think the format would be best suited for people in private offices do not need them, but if you're in the general public or within 6 feet of coworkers, you would need a mask on in those spaces. Currently, unvaccinated people are already required to do so in town buildings. This would just extend to all people.
Can I ask a
Is there-
question? Oh, sorry.
Yeah, Chris, sorry.
Just based on, Jeff, on your wording, because I think I heard it two different ways. One way I heard it, oh, I apologize, I'm getting a call. One way I heard it was that it would be a vote to recommend to the select board and town manager to put that into place. So that kind of made it sound like you would recommend that they institute a masking policy in the buildings. Is that what you meant, or did you intend? The other way I heard it was that you would make the vote to recommend, and that would just stand. That would be a recommendation that people do that, and maybe there's a sign on the door that says we recommend.
Well,
I didn't know which way you were going with that.
well, that's something that the Board of Health would need to actually make a choice on how they want that recommendation to be put, on how they would like it to be presented. I'm just presenting all the information I have on what they can make a decision on.
Sorry, I'm not in a quiet place. Is there any comment from board members on that?
I'd be open to making that motion to recommend to the town manager and the select board that the Board of Health recommends that masks be worn in all town buildings until our September meeting.
I'd be happy to second that motion.
Thanks, Sue and Zach. Is there any commentary on that? Okay, then with the motion made and seconded, do we have a vote? I can't see people, so I'll say, Zach, how do you vote?
I vote aye.
Michelle? Aye. Joanne? Aye. Sue?
Aye.
And I'll also vote aye, so the motion passes unanimously, and I apologize for my location.
No problem. I can't tell what it is, but it sounds fun, whatever it is.
Moving college kids in.
Oh, I hear you. We'll be there in a few days. Anything else from the Board of Health? Thank you for that. I don't know if there are any further comments from either from Jeff or Ray or Gail or the board.
Gail or Ray, do you have anything you'd like to add at this point?
Is that effective immediately?
Yeah, since it was my motion, I was assuming it would be effective immediately.
Okay, thank you.
Hi, this is Gail. I have nothing to add. Thank you.
Thank you. All right, well, thanks, guys. With that, I think we can move on to our next old business item, which is masks and testing protocols in Westford Public Schools. And with that, I'm going to hand it over to Dr. Chu to give us any updates or recommendations you have. So
thank you. So I did draft a memo, and it was posted in the packet. Hopefully people are able to see that. That has my recommendation, well, based on the fact that the Board of Education has authorized the commissioner to mandate masks K through 12. That piece of a recommendation is not included in this memo, because that's a decision that's already been made for all public schools in Massachusetts. My recommendation is that we choose to utilize the diagnostic testing that has been made available by the Department of Education, specifically the test and stay, and we are looking to explore the symptomatic testing. I had mentioned that in my email on Friday to families as well. We did apply for the program, and we were approved. We found out today at 4 o'clock that we were approved. So within 48 hours, we're supposed to be contacted by CIC Health in terms of beginning to onboard that process. We want to start with the test and stay. We're authorized to purchase Binex Now tests through DPH through this process. And really the question is how, if we were to utilize the symptomatic testing, we really want to talk more specifically with our school nurses after school starts, because there are concerns about whether that process would become an additional burden on the nurses trying to do their regular work throughout the day, whether that is something that CIC can be supporting us on, and whether it would be something that wouldn't be interrupting the nurses, or so that's still questions that we have. So we want to explore that. So my recommendation is that we move forward with that testing, with the diagnostic testing, specifically the test and stay, starting that and having that information sent to parents so that they can return the parental consent, because all testing requires parental consent. If parents do consent to that, then if their child was identified as a close contact in school and they elected to participate in the test and stay program, then they would be able to get tested at school. And if they remained negative, they'd be able to stay in school. If they don't consent to the testing, then they would need to quarantine at home, and they wouldn't be able to stay in school. So that's a piece of that. We're trying to minimize the amount of time that students might have to be out of school. So that recommendation is in the memo that I gave to you. We've also already created a frequently asked questions document that is also already published on our website. We took down the confusing information from April, and so we have now our fall 2020 opening information, and we will continue to populate that with more information. But we do have a frequently asked questions document that has addressed some of the things that have come up already, and I'd be happy to talk about those specifically. But more importantly, I just want to direct families to that information first. Are there any? I see, Sean, you have your hand up.
Go ahead, John. Are you resending? Okay, go ahead, Sean.
Sorry, Chris. I don't know if you still have some more. I'm happy. I don't need to have it answered now. Mine's just kind of a question about test and stay.
Sure. My recommendation, I just wanted to share the information that we had in the memo. The memo is also supported by our consulting physicians. Again, in a Zoom environment, it's difficult to figure out exactly what we should be presenting. And I'm assuming that people have access to the packet because all the information has been put in the packet along with the supporting information from our consulting physicians. I did say in the memo that I was grateful. I do want to reiterate that. I'm very thankful for the support. Jeff Stevens and we've gotten to know each other very well in my short time as superintendent. I'm sorry that he's going to be leaving us, but I appreciate the work that we've been doing together. And Gail Johnson has been able to help us. And I've been meeting with our consulting physicians, Dr. Egan and Dr. Sheehy as well too. And they've been very helpful in counseling me as I am not a medical professional.
Catherine.
Dr. Chu, I was just wondering if you could walk us through your reasons for, you're saying you're looking at we put in for the test and stay testing, and we will look at the symptomatic testing. Could you walk us through in terms of that third option that was also available, the routine, the COVID pooled testing, as to why you don't think that is an option? And the second part to my question reverts back to the test and stay. I'm just curious as to, does that apply for kids who are less than 3 feet apart? Is that still okay to keep them in school? Because I don't think we're going to have every kid at 3 feet apart from what I can gather.
So if I can answer that last part first.
Yeah.
Right? So the close contact in the classroom, a close contact would be a student who was within that 3 feet, right? So we're talking about close contact. So they would be identified and they would then qualify to participate in the test and stay program. So it is actually those specific students who would be identified as a close contact if they are masked and within 3 feet. If they're not masked, then it's within 6 feet still, but we're masked. So we're talking about the 3 feet distance. As far as the it was previously called pool testing. So forgive me for using the old vernacular, but it was previously called pool testing. And so all of the conversations that we had, I was continually being recommended that the pool testing wasn't actually going to be as effective for us, for the specific reason that you really need to have significant participation and buy-in in order for that to be effective, for us to really have an understanding as to whether or not there is whether or not there's spread at that moment in time on these pool testing, because again, it's parental consent. So everyone would have to be consenting to have their students participate in the pool testing. I will say, based on just knowing how our parents were responding, I think, to both concerns about masks and non-masks, I would be concerned as to whether we would have significant participation in the pool testing. Now, we have the ability to change our mind in this program. So that's why my recommendation is starting with the test and stay, because that was something that was significantly different than what they had as an option last year. And so that ability and the symptomatic testing using the Binex Now tests, which I'm being told are wonderfully accurate and has improved even during this process. So that is why my recommendation is to explore those two options at this time. But by being in the program, we can choose to not do any of them. We could also choose, if we did at a later date wanted to explore the other option as well too. But that's why my recommendation is for the diagnostic testing specifically.
Gloria?
Thanks, Chris. I just had a couple of points of clarification, because I want it to be super clear to the committee and the public as to what we'd be authorizing. So my understanding is that DESE's vote this morning talked about kids 5 and up, and your recommendation, as it's articulated, says all students. So is it your recommendation that all of our under 5s, all of our preschool students would be masked just along with all of their older cohort?
So thank you for that clarification. I think that's something that we can talk about. We did not mandate masks for our preschool students last year. However, all of our families chose to send their students to school wearing masks. The guidance from the commissioner, he specifically keeps talking about 5 and up, and he consistently keeps saying K to 12 and not including preschool. My recommendation, honestly, was first to follow the K through 12 idea, knowing that our families at the preschool level, I feel like there's a greater conversation to be had there. And our families chose to do that last year without us mandating that. So that I didn't make that much more clear for you at all. I would be open to that conversation with the committee at this moment in time. And I'd also, I would want to hear from Ms. Moran as well too.
That's what I was going to ask. Courtney, would you mind speaking to that and give your observations from last year and your recommendations?
Sure. As Dr. Chu articulated, it was recommended last year, not mandated. And we were pleasantly surprised when all of our preschoolers were showing up with a mask on. Some of our students took a little bit of time to get used to that, and the teachers did work with them if parents sent in masks with the expectation that they would be using them. We also purchased bucket hats, which were had a shield on it, which was a different option for some of our students. That being said, I think one of the public comments earlier were talking about how younger students might be mouthing their mask, might be taking it on or off. And so there are a little bit more challenges to having a younger student wearing a mask. And my recommendation would be just to recommend it and to promote it, but not to mandate the mask wearing for the preschool students. One of the exceptions would be on the van. The transport, if we do have a preschooler who is taking the special education van, masks do need to be worn on transportation.
Thank you. Other questions, comments, Gloria?
Well, yeah, I guess my follow-up to the preschool discussion is the dynamic is a little different this year because we will be having the integrated peer models back with the preschool. So I know there'll just be a larger number of kids in that space. So I guess I don't know how if that changes the dynamic or your comfort level with the decision to have it be recommended but not mandated.
I think it will also be a challenge with more students to make sure that the masks are staying up and properly being worn. So I guess I can see both sides of it.
I think it'd be important for us to be working with the principals to figure out what additional support that they might need, even in communication, if we weren't to do that. So my recommendation was that was specifically focusing on the testing and stay because the masking discussion had been already decided by the commissioner. So I would say that is a typo on my part to say all students in the memo, because that is not what the mandate from the state is going to be. But if the committee chose that they wanted to mandate the mask for preschool, it would be above and beyond what the commissioner is requiring.
Do we have other comments from committee members on that? Are people feeling strongly one way or the other on that, Valerie?
Would we need like a motion, or if it was just falling under the recommendation, or does that just kind of go under existing guidance?
I think we'd want to clarify with the motion. But Gloria, what were you gonna?
That was exactly one of the reasons I was asking, because I think if we were mandating masks at the preschool level, we absolutely would need that to be part of the motion and the vote, and we would need to authorize the superintendent to have that authority under, our new policy P5517, because that would be over and above what DESE has mandated. But if the superintendent and Director Moran aren't asking for that additional authority to mandate it at the preschool level, then no, I don't think we would have to take a vote on that, because we're still in line with DESE and we're not going beyond it. I think we would only need to take a vote on the testing portion, and we wouldn't need to vote on this. That, my 2 cents deferral to the will of the committee and the chair.
Yeah, I think the discussion, I think the purpose of the discussion is to talk about our feelings on the recommendation, and then I think it allows us an opportunity also to, if the superintendent, based on something we're saying, so chooses, he could add something, amend his recommendation verbally to us tonight, and that's how I think any changes, that's how they would get in there. And so I think the conversation is important as he's listening to our thoughts and our input on this, and to see if it's in line with the written recommendation. But this is the first time we've done this, so I think we're kind of feeling it out a little bit as well. Alicia?
So I would also say that our new policy allows the superintendent, in consultation with the Board of Health and with Director Moran, to change to recommend something should there be a need. So if we accept the recommendations this evening and they find that they do need to changed their recommendation to universal masking in preschool, which I understand was not what we did last year. Our policy enables them to do that should there be something like a spike in cases at the preschool level, or a positive student with a close contact. The policy allows them the agility to make.
I guess I would also jump in a little bit on the testing, and I will admit I'm certainly not an expert on the testing, and I defer to folks who have more knowledge and understanding about the various kinds. I think I have a grasp of what we're looking at. My understanding from what I've heard, and again, this may be from reading articles or anecdotally, is that the diagnostic testing has been effective in a lot of locations, and also that the symptomatic testing is a really important tool. Understanding that there are concerns with, is there going to be abuse of it? People sending in symptomatic students, and how much time are we spending for our nurses testing? But I will admit that I also feel, and this goes back to, we had questions during public comment about, are we offering a virtual setting for students this year? And we're not able to. There are also questions about, like, how do we handle longer absences? And I want us to talk about that a little bit in absence policy. But given that we don't have a safety net with virtual learning. Now I know, and we've talked about this, that we will obviously deal with any student who's out for an extended time, as we always have, right? This is not a new thing to the district, that we have students who might have an illness or another cause to be out, and we handle those. I think for me, the concern is the numbers, and are we going to get, if those numbers start getting up, it's harder and harder to deal with those individually. So to me, that's what I'm saying when I say I feel like we don't have that safety net. And so in that case, I would certainly want us to, I think, vigorously pursue the diagnostic and symptomatic testing, because it just gives us that extra layer of protection. And we see how quickly things can change. I mean, you look at Westford numbers last week to this week, and when you consider that, quite a few of those this week are potentially student age residents, it does make me concerned about how quickly things can change. And if we have a way to mitigate that, I wouldn't want us to leave it on the table.
And to that end, if I can interject, the onboarding process working with CIC Health is going to provide us a whole bunch of new information, right? Because last year they offered testing, and then districts were going to have to pick up the cost at some point, which also was a concern for many people. There was also a great deal of confusion as to the logistics of how that was going to take place. Well, now they have committed to not charging us, and that they're going to continue to cover the cost of this. And they now are setting us up with a partner from CIC Health within all of our buildings to figure out the logistics of that. So that's where I feel like over the next couple of weeks, and specifically at each of our meetings, I can give you more specific updates as to what it looks like, the impact that any of this is having on our health clinics, and which will help us kind of decide, all right, do we then explore an additional, whether we explore the pooled testing, and or when are we ready to implement, if we choose to, the symptomatic testing as well too. I do think an important piece of information is that students who would qualify to participate in the test and stay, it's also clearly identifies that it clearly states that they were identified as a close contact in school, and that it was because of potential transmission in school. So if someone is identified as a close contact because of choices that they've made outside of school, it does not mean that they're going to be able to send their child into school and participate in the test and stay program. That's something that they've outlined specifically. So that's another thing that we'll have to regularly communicate with people, and we'll have to make sure that our nurses have all of the support that they need in terms of when people are saying, well, why can't my child do this or that, when, you know, it was because they had gone away for the weekend and now they have a close contact, as opposed to because they were sitting next to somebody in school who then had tested positive.
Thanks. That's an important clarification that people will need to be reminded of and understand. Hands up, I saw Catherine and then Sue. I think I saw your hand up. So let's go with Catherine, then Sue, then Gloria and Sean.
Actually, Dr. Chu, you just answered the first part of my question there, which was the, you know, did the close contact have to be in the school environment in order to qualify for the test and stay? My question is then, is what happens for the families whose maybe family members are actually frontline workers who, just through the nature of their job, are potentially, you know, creating that close contact, triggering that thing. In that instance, are we able to test those kids of those families in order for them to continue coming to school, bearing in mind that essentially our doctors and nurses are potentially, you know, going to be close contacts multiple times throughout this. I'm just very aware of trying to keep kids in school as much as possible.
I don't believe so. I don't believe that there's an exception to that, but I will look into that. That's going to be questions that we can get on the onboarding process as well too. I'm not sure if a district would be able to select additional people that they could test in the program, but I just don't know the answer to that question. So I'll look into that.
Sue, did you have a question?
No, it was actually Chris had clarified it as well. When you made the comment about symptomatic, you know, testing of symptomatic, and that is not what the test and stay is, as Chris said, it is for the close contacts. And the way I look at it, you know, I'm on the Board of Health, but I'm also one of the school nurses, and we're in support of it because those tests for the test and stay, they're quick. And if you're a close contact, you know, we would know right away, possibly, if there's a positive, and we would, you know, the child would be isolated and sent home. And if not, they'd be sent back to class. I kind of think of it like a strep test. When you go to a doctor's office, you find out right away that you had strep. So I think there's a lot of reasons we're in support of the mask wearing, because there isn't going to be the distancing that's going on that we had before. So until we have more data in the school system, I'm thrilled that the commissioner made the decision that he did. And I am on board with doing the test and stay, anything we can to keep the kids in school. I think all of us here feel that way.
Thank you. Gloria.
Thanks, Chris. I'm all about the triple checking and clarifying what we're being asked to authorize tonight. So on the testing, it sounds like we're just discussing the test and stay for school-based close contacts and potentially the Binax Now symptomatic testing if a child presented with ambiguous symptoms, like during the day, like they develop a headache during the day, and you just need to clarify, no, this is just a garden variety headache, you can go back to class, and that it's not potentially a COVID case. But we're not talking about any routine testing of students. It's only those special situations. Am I correct?
So that is my recommendation, yes, that we are exploring that. By applying to be a part of this program, we have access to all of them. And we can change our mind as a school district as to what we want to use. My recommendation is that we explore test and stay, that we get set up for that, and that then we're prepared to explore the symptomatic testing if we feel like that is something that would be beneficial after I think our nurses are able to be in the health clinics. All of that being said, it all has to have parental consent, right? So if we did decide in the future that we wanted to do the I keep saying pool testing, forgive me for saying that, but if we decided we wanted to do that, then to me, that would be a part of this protocol that we've now put in place, where I would come to you and say, this is what I would like us to now start exploring. And so it would come back to the committee, because it would be a change in those recommendations. If that, I think that's kind of the clarification you were looking for. Is that accurate?
Yeah.
What I do want to say just one other thing too about the symptomatic testing. So the same thing that took place last year when the school nurses, it would be a combination of symptoms, right, that we were talking about that would happen. And so the school nurses were being asked to make decisions on a daily basis as to, whether or not they were going to suggest that this child had multiple symptoms and they should go get tested, whether they needed to go home, whether they could stay, talking to families all the time. And Sue can speak much more eloquently to this because she lived it. If we explore the symptomatic testing, it's still that same amount of triage. It's not, oh, a child just has a runny nose in the middle of the day and then they're going to go down and get tested. The school nurse would still be looking to see, okay, are there multiple things going on here that it would warrant that, in the same way that they would be looking to see, are we looking to suggest that you would go home and get tested? So that layer of communication is still taking place. What we need to decide is if having the ability to do the symptomatic testing in school would be helpful, or whether it's going to create an additional scenario. But it's not just in response to one isolated symptom that then they would be tested. I just wanted to make that clear.
That's helpful. Let's see, Sean.
Thanks. Chris, would we extend the test and stay, right? I mean, I get it. The goal is to keep the students in school. Would we extend that to extracurricular and sports too? Or if they had a close contact, would their day just end at 2:30 or whenever?
Well, if they participate in the test and stay, then they would continue to be able to participate in activities as well too, right? So I think that answers your question, right? So if someone is playing a sport and they were identified as a close contact and they elected to participate in the test and stay, and the tests kept telling them that they could stay in school, then yes, they could continue to participate in whatever they were choosing to do. The reverse of that being, if they didn't participate in the test and stay, and they were then having to stay out of school, they wouldn't be able to participate in any of those activities as well too.
Okay.
But I interpreted the question as the triggering event occurring at athletics rather than in the classroom.
Got you. Thank you. If they're identified as a close contact based on a school activity, a school event, in the classroom, or yes, if they were identified as a close contact because of a sport or an activity, then yes, they would still qualify, if that was what you were asking.
I actually asked
We covered both of those.
But
Okay.
I had a follow-up question that Chris Sanders asked. So I appreciate both responses. Thank you.
Great. That being said, I do want to say to all, if the school committee has specific questions about other things, and we have put things in our guidance, I would be happy to talk more about what school's going to look like. I was focusing my energy on the recommendations at this moment in time and on the testing. So if you have questions that are not about the testing, I apologize if I haven't answered those questions. I'd be happy to talk more about that as well too.
Catherine, you're up.
Chris, I think you and I are in sync tonight, because I was going to ask you a question that's not necessarily related to testing, but somewhat is. The CDC is still recommending, if we can try and maintain the 3 feet of distancing within the classroom. And I know today in our school tour of some of the school buildings, we're not necessarily doing that with the desks in the classrooms. And I'm just curious as to, in the instances where we could do the 3 feet of distancing between students, why we are choosing not to. If is that a conscious decision that we've taken, particularly as our letter from our doctors that's in the packet is talking about Delta being more contagious.
So So first of all, where we can, we are looking to try to encourage the 3 foot of distancing. With all of our students coming back, we don't have the same ability to space everything out the way that we did even in April when we came back to school. At that point, we still only had 2/3 of our students in the building. And so we were able to maintain the 3 foot of spacing. It's also incredibly important that our classrooms return to that flexible environment. That is the hallmark of the in-person learning, their ability to collaborate and communicate. And so what you saw today were the classrooms returning to those ability for students to be able to work with each other in groups, as opposed to keeping everything, even if in some spaces it would be easier to keep the desks apart. We're trying to allow for the students to be able to work in small groups with their teachers and with each other as well too. Now, we are looking to make sure that when their masks are off, that they are maintaining at least 3 foot away from each other when they're taking their mask break, when they're having lunches, even though there is no specific restriction in that regard to what we're doing. But it is a choice on our part to try to get our classrooms back to the flexible environments that I think is part of the success of our students' regular experience at school.
And if I may, there are some other additional strategies that we're utilizing and taking that into account. So for chorus and band, for example, we are going to have students 3 feet apart with masks, including the bell covers for the instruments. We will continue to have air purifiers, as Zach mentioned, throughout the schools, strategically placed. We're encouraging classrooms that are on the outer walls to have a window open. We also have the air filters that we brought in last year. They were MERV 13s, and those have been replaced periodically and will continue to be replaced periodically. So there are other measures that are being used to make the air circulation and just the air in the buildings safer as well.
Okay, thanks. Gloria?
A hopefully quick just process question on back on testing with the parental consent. Would you be looking for parental consent in advance of a student being designated a close contact, so it would just be on file?
Yes, that's what we're looking to do, is that the forms that DESE and CIC suggest that we use, we'll be sending those out to families, and it would be similar to families who have allowed allowed the nurses to administer different type, aspirin or Tylenol and things like. So it'd be something that they would have on hand, that they would know in the event that would happen. Now, that being said, they could still reach out to somebody if they had not sent that in. That's just going to become more laborsome if that becomes the case. So we do want people to fill it out ahead of time, and we're hoping to have it ready with our opening day packets for families.
So going along with that, if parents would be opting in at the beginning of the school year to the testing protocol under P5517, it sounds like based on the DESE ruling as of today, we don't need to take a vote on any masking at this time. We might have to take such a vote in the future, but we would be taking a vote to authorize the implementation of this testing protocol. Our policy states that we have to provide you with that authority for a certain duration. So what would your thinking be as to what that duration should be as an authorization from the committee?
So in terms of the test and stay, I feel like that's something that we should be exploring for the school year. I do not foresee a scenario where we wouldn't necessarily still have that as a resource because it's being provided to us for the length of the school year. But I still expect to be reporting to you on a regular basis. So as far as the testing, the test and stay aspect, and it's going to take us a little while to figure out if the symptomatic testing is something that is going to be helpful for us in our mitigation strategies as well too. So to me, that aspect of it, I would suggest would be for us to implement for the school year, the testing.
Right.
scenarios.
So the authorization would authorize diagnostic testing, both the test and stay and the symptomatic. Then you'd have that authority, and then in consultation with the nurses and the building principals, determine how that's and if that is utilized. But
yes,
you'd have the authority for both of those diagnostic testing for the duration of the school year. Great, just checking. Thanks.
Thank you.
Well, just to be clear, the recommendation talks about exploring the symptomatic testing, right?
So I will say, but what Gloria just said is the symptomatic and testing now are part of the diagnostic. They separated into two categories. So I'm saying that we participate in the diagnostic testing. We start working with the test and stay, and as part of the diagnostic testing, we explore the symptomatic tests as to whether that's going to be beneficial for us or not. But I do believe that it would be a part of, I want to work with the schools and with the school nurses before we decide whether we're going to utilize the symptomatic testing. But I do think that you should authorize us to be able to do it.
Okay. And so I think process-wise, we can take that sort of that nuanced amended recommendation verbally as given and vote. When we vote to accept a recommendation, that will be part of the record of what the recommendation is. I'm going to say that it doesn't have to be written. We don't have to update the memo, but by record of this meeting in the minutes, it will reflect that clarification on your recommendation. So I appreciate that. I guess I would say, you said diagnostic. I thought diagnostic also referred to what we keep wanting to call pool testing.
No, that is the routine COVID pooled testing. Okay. It's actually in the packet. We have the statement of assurance, which breaks it down.
Yep.
And so when we applied, I had to tell them what we could change it, but I had to tell them what our intent was. And I said the diagnostic testing, both the test and stay and the symptomatic testing, which is under the diagnostic heading.
Yeah, right. So I guess I'd be curious to hear how the rest of the committee feels. I as long as we're talking about exploring, I would really want to include the pool testing, the routine COVID pool testing and school-based follow-up. I would want to include that in the exploration. I guess I don't want to in any way preclude us from exploring and using a tool like that again could help keep students in school. And I would want to put it in the same classification as the symptomatic, that we would explore it. And then you come with,
so you're giving recommendation. So your suggestion is to give me the authority to continue looking into it as opposed to the expectation that we start using it.
Exactly.
Okay.
Yep. Let's go, Alicia.
So when we make the motion, I would actually recommend that we don't limit the motion just to the testing. I think we need to make the motion to authorize the superintendent for the 2021-22 school year, authorize the current recommendations, because Carrie was talking about 3 feet for band and air purifiers and windows and filters, and all of that is in the recommendation. So I would say that the motion we make needs to authorize current recommendation superintendent, then come to us, but the current recs.
Okay, thanks. Valerie?
I was gonna ask some questions like kind of higher level than the motion and the testing. So if Gloria had something to add on to that.
Yeah, I know we probably want to broaden the discussion to other things beyond this. So thank you, Valerie. I did just have a follow-up thought on that. And yeah, respectfully, Chris, I think I would suggest keeping the motion to what the superintendent has currently requested, which is the ability to implement the diagnostic testing, both the test and stay and the symptomatic, if it is determined that it would be useful. I would think we would leave the routine pooled testing aside for the moment. Of course, the superintendent can continue to discuss that and explore that. And if it is determined that that would be useful, I think that would be a separate vote. I feel like that's a separate monster, and it's a separate process. And if we wouldn't be seeking parental consent for routine testing at this time, I don't think we need to make the authorization that broad. I think the public would want the opportunity to weigh in and discuss that before we authorized that broader kind of blanket routine testing of students. I think that becomes a very different thing. So I'd separate the two. But that's just my 2 cents. But I know, Valerie, you had other topics we also want to get to, which were touched on in a lot of the questions and public comment earlier tonight.
I'm happy to wait if we want to get closure on what the motion would be.
I would suggest we keep it open. I think, anything that bubbles up in this conversation has potential to affect the motion. So I don't think we need to close anything on the motion yet. So I'd say go ahead, Valerie.
Okay, well, I was just gonna kind of bring us back to Commissioner Riley's memo. I'm sorry, just bring us back to the FAQ that you took some time to put onto the packet and on the website. I really appreciate that. And I think a lot of the things that families are wondering about that, will apply in 7 or 8 days when kids start showing up at school is really in there. So I would encourage families to take time to read that. Some of the things that we've seen in emails come up about athletics and extracurriculars, volunteers in the building, lunches is mentioned, but a couple of things that I was still wondering about. I don't know if you had a current snapshot of what our ridership for our buses looks like. I'm just curious if we'll be at kind of our normal capacity, our pre-COVID capacity, or if we're down again. And if you could talk a little bit about any restrictions. I know masks obviously are required because it's public transportation, but are the seating happening again? And I was also curious if you plan to reinstate the COVID dashboard. And I also wanted to know, I don't know if Jeff Stevens is still on, but I know he talked about specifying the vaccination rates just for WA. And as that's clearly mentioned in Riley's memo, I'm sure people are wondering what we are currently at there. And then if we have any insight into what our staff aggregate numbers are. Sorry, I know that was a lot.
So no, I actually heard everything you had. So we don't have it school by school, and there's been no way for us to know that. What I can get is age groups through the state, and I can tell you specifically what age groups have been done. But I can't tell you what staff has been vaccinated because there's no mechanism to know where people have been. People have gone all over the state to get their vaccine. So it would take a pretty monumental lift of staff that we don't have to go through MIIS and go through every staff member. And that's not something that we could do, at least not in any short amount of time. That's something I think you would probably get better information polling on your staff, and we can use the state reported numbers on the age groups.
So yes, I would say I think Jeff, if you can correct, I want to say the 12 to 15 numbers in Westford were, I think they were at 77%, or was it 70? I think it was 77% fully vaccinated when I last checked. And that information, for people who've asked, that comes directly from the mass.gov website. And like Jeff had shared earlier, that our 16 to 19-year-olds in Westford, it's above 95% of the information. And that information, some people had asked us questions. Well, my WA student has never taken a survey saying that they were vaccinated. The information comes directly from when people register and get the vaccine, and they're that's how they've collected that information. That's correct, Jeff?
Yes.
Yeah.
Yeah. So the state reports that out of one of their websites, where they can pull that data and they can give you an age group. And they also pull data out of the Bureau of Environmental Health on the amount of people in surveys that live in a community. So there's an approximate estimation of how many people we have in every age group, and that's what they match that vaccine data up with.
Thanks. To answer the question about the staff, we are working with WEA to see if they would help us collect that information on a voluntary basis first, to just start. And I think if WA reaches out, and that's something that I was speaking with the president about, and she was going to start reaching out to different groups to collect that information, so that we'll know, because that's going to be an important piece of information as we approach October 1st, based on what the commissioner is saying. We know what our age range would be, but we would need to have collected the information as to our staff vaccination rates based on what the commissioner was initially talking about, part of the off-ramping of mask wearing, if that is approved on October 1st by him to do that. Your question about the buses. So in talking with Jen Piper, our transportation coordinator, I don't know the number of ridership at this moment in time. If it's different, she's been busy getting all of the bus passes going, and in our conversations, she hasn't expressed a concern, but I will get an answer to you as far as that is, because I think that's a great question. The expectation on the buses is that the windows are going to be down. The bus company D is keeping the numbers on the seats so that students will be able to know seats and row numbers that they had in the past. One of the things that we knew that we were able to utilize last year, and we still have access to moving forward, is that we do have access to cameras on the buses in the event that we need to identify a close contact on the bus. Because even if everybody knows what seat that they're sitting in, the reality is that not everybody's on the bus every single day. And the bus driver can't possibly take attendance while they're also picking everybody up and then checking names off. They wouldn't be able to do that. So we knew that we would need to be able to rely on the cameras if we did have a case of identifying close contacts on the bus. However, Desi has already said that if masks are on and if the windows are open, they wouldn't be identifying anybody on the bus as a close contact. So that's one of the changes that they have made. So that hopefully that answers your bus questions, knowing that I'm going to get an answer to you about the ridership.
Are we still doing that spray mechanism in between? Do you know?
We were still talking about that. I follow up on that as well to find out if that's happening between every run as it did, or if it was happening just at the end of the day. But they were still utilizing the electromagnetic sprays, so we'll follow up with that.
Other comments, questions?
And sorry, in between my monologue, I also asked about the COVID dashboard.
Oh, thank you.
Sorry.
So I feel like that's something that we should talk about with the Board of Health too, because I do believe that having multiple dashboards is not helpful. We will be communicating the information to families as we did in the past if there are close contacts, and if there are positive cases, we'll continue to do that. And I think there might be a way that I can be sharing that information with you, even in our regular meetings as a COVID update. But we haven't talked about creating or establishing a school-based COVID dashboard. So that'd be a good question, Jeff, as to the town.
Well, I wouldn't be opposed to chipping in. Well, it's actually not going to be my call after Wednesday next week. But I am sure the staff would be interested in helping with a town-wide COVID dashboard that has all of that information, depending on what you're looking to put on it.
So we can continue to collaborate on that. I know there was also just a concern. There's just a concern about how certain information is shared too, because we do have to make sure that we're maintaining privacy as well.
Right, and that's why what we share on our Facebook page and on the town website is very specific to make sure that no person, group, or individual has any identifiable markers that could pick them out. So we're really careful on what we give people for information. And there are several requests every week for specific data on even neighborhoods. And I'm hesitant to do that. I mean, we'll give age ranges, and that's about as far as we'll go. And it's more than what most other communities give, because it falls outside of what HIPAA really calls for.
I'd certainly, just to jump in on the dashboard, I think doing a combined dashboard could be a nice efficiency of scale a little bit. So, we're not duplicating effort. And I would just make the request that we actually have two asks, and you guys can tell me if they're reasonable. One is, I know I keep mentioning it, but I find that cases per 7 days per 100,000 residents, because I think it is really telling about rates, and because I think it's sort of a standard that's being used nationally, but yet can apply to your local data. I'd certainly like to see that, because I think, nationwide, that's what they're using for the color-coded low, medium, substantial, and high. So I just think that'd be nice, and it's pretty easy. It's a column in your spreadsheet basically to do that. If the state doesn't give that exact one, but they give something, they do a 2-week one, whereas the CDC says a 1-week one, but that's easy enough to tease out. And the other would just be to look at our district website. I think there's still some confusing links, and there's some old data from last year. I saw it's like last year's reopening plan. So we might just want to look at that and just clean it up, so it's really clear where everybody's going for the FAQ, for any dashboard data. But I imagine that we would do that at the start of the year anyway, just sort of clean it up and make sure it's clear for everybody. Catherine?
I'm just following on from Zach Cataldo's comment earlier about the air purifiers. Are we happy with the state of all classrooms and school buildings in terms of that ventilation and air purification, or does that need to be revisited at all?
Well, I think we're continuing to assess it, but what we had in place in the spring, we still have in place at this moment in time, and plan to in the fall. I mean, our classrooms that have access to windows and to fresh air, we want to keep those windows open. And that's the best part of, if you remember, Paul Fox likes to say the dilution, I can't remember what he said, but the idea that we want to bring in as much fresh air as possible. The solution to pollution is dilution. That's what he said, right? And so we have air purifiers that we purchased, that we are continuing to maintain. I actually had somebody, and forgive me for not being able to give this person credit because I can't remember who it was, but it was a parent who sent me a pretty phenomenal article about some citizen scientists who had created an air purifier. And so it was a DIY scenario that would actually be a pretty interesting thing to share with some of our science classes, to see to see how students might respond to some of these aspects, but it's not something that we are in need of as much as it could be a really phenomenal, authentic problem for students to be exploring as well too. But we do have what we put in place last year. We are continuing to communicate with the faculty in terms of people's needs, and we are supporting that.
Can I just check on that, Dr. Chu, in terms of some of the library spaces, and I'm even just thinking of, which one was it this morning, Robinson, you know, where there's the windows are maybe high up, they're not being opened, you know, the ventilation system might be a little bit more outdated. Are those spaces, do they have air purifiers in those?
Well, so in the very large spaces, I mean, the idea that we were making sure that our air circulation systems in the buildings were doing the job that they needed to be doing. We were putting the filters into those systems in order to make sure that they were circulating air and changing air at the rate that they're supposed to be doing that. And so the work that we did last year, we're continuing to make sure that we stay on top of, and we're continuing to do the weekly diagnostic tests. The head custodians are going around to make sure that they're checking everything, and we're posting that information as well. We're going to continue doing that. So what I don't know, I can't speak to whether an additional air purifier in that large library space is necessary, or if the actual circulation of the air with the filters that are in place is already doing that job. But that's something that I'll make sure that we keep working with Paul Fox to assure that what we need to take place in order to make sure that that air quality is where we think it should be, that is maintained.
And Alicia, I see your hand up. Before we go on, just on ventilation, I think a good thing to remember is that an open window doesn't guarantee air circulation and doesn't guarantee air exchange, right? An open window, if there's no air movement, which there can be, right? If you don't have an avenue for the air to flow. So just, yeah, I think making sure then all the buildings, not classrooms, it's case by case, looking at whether there actually is sufficient airflow and circulation and ventilation. Alicia?
So two things. One is quick, one is not. The first is, I know that our Westford numbers tell us how many Westford kids are vaccinated. We do have school choice kids, and I know it's a really small percentage, and we do have some staff that have students from other towns that do attend. I don't know that that would necessarily change our percentage. It may be a very, very small number, but I know the question is being asked. Do the out of town kids that attend, will that have positioning them back?
So yeah, the first question about the percent, I do think that the percentage would not impact our overall percentage, but it's not impossible for us to ask those questions as well too, right? So that's just us looking at the data without us having to actually ask. And with the greater than 95% for our 16 to 19-year-olds, then there isn't any way that our school choice and or staff students would bring that number down to the 80%. With the 12 to 15 moving up to the 80%, then it could have an impact on it. But we'll look at that, and I think we can continue to ask those questions as well too. As far as the attendance, I'm glad that you asked that question, and we get back to that. So we do know that historically, Chris had mentioned this earlier too, historically, we do have students who are out for a week or more at a time, and we have already implemented strategies to help support those students, whether they're able to work or when they return to school, whether it's something that needs to be, whether the work needs to be modified because they've been out, and when they come back in, working with students individually, we're going to continue to do that. Now, what we know is that the numbers might be larger. And so while remote learning is not an option as a strategy for our school system to employ, what we do know is that we do have technology in place, and all of our classrooms have been connected with Google Classroom in ways that it was not universally used throughout the district. We're going to continue to use that platform in order to share information, to communicate. And I think what we need to be looking at is what is the age appropriate and even the individual's ability to utilize that platform, depending on the course, depending on the content area. One thing that I think we just know would be, I think a huge mistake would be if our youngest learners were then expected to try to log in all day long a classroom. We didn't think that that was a good strategy in the first place. Whereas it might be easier for some of our older students if there was a Chromebook at the back of the room for them to hear what's going on. It might be an easier thing for them to maneuver. So we really need to look at it on an individual basis, the way that we really would any student who was absent from school. But we do have these strategies in place, so we're going to continue to utilize them, even though we can't establish a fully remote option for families. We are being reminded by the state that we already have very specific requirements for students who need to be out of school for medical reasons, and tutoring that would take place after a certain amount of time. So the state is reminding us that that still is in effect, and so we would still need to be looking at that. But it really is going to be something that we're going to have to assess as we move forward.
We were on with surrounding area superintendents and assistant superintendents today, and this truly is the $1 million question. And it's an uncomfortable answer to share that it's going to be case by case, because what can be done for a first grader is very different than what could be done for an 11th grader. And even within the high school level, for example, it depends on the case. There are times where students are just simply absent for several days, and that is pre-pandemic as well. And so we're going to be assessing what we can do for the students as the cases pop up. One thing that we just simply don't have an answer for right now is, and hopefully that this is less of a concern with parents, because big picture, this won't matter, but from a school procedural perspective, we have to know if people are trying to participate from home, is it marked as an absence? Is it not marked as an absence? Certainly, if it's ever marked as an absence, it's not going to be used against students in any ways. There are certain procedures that we have to do as a school district when absences meet a certain threshold in terms of potentially getting other organizations involved. But if we know that this is because of COVID, of course, we would not be sending such letters home or contacting outside organizations with concerns about attendance. So this is the area that was triggering the most frustration with the superintendents and assistant superintendents today.
Rightfully so. Thanks for that. I want to give those of us still here a chance to ask any remaining questions for our Health Department and Board of Health guest. Actually, let me just say Health Department guest. Any final questions for Jeff? And we could let Jeff go. Looks like that's a no. Thank you so much for your assistance and your collaboration, your presence here tonight, your information, and your service to Westford. We know, you are moving on to your next adventure, and we may not be seeing you again in a meeting like this. So just appreciated all you've done, and especially for sticking with us here tonight, Jeff.
Thanks for having me on. I will miss working for Westford, but the opportunity to work in my hometown is just a little too good to pass up. So I'm going to take that opportunity. They don't come around too often. I'll be here till Wednesday. If there are additional questions or something comes up, feel free to email. I'll be working right till 4 o'clock on Wednesday, and then that will be my last day. So thank you very much, everybody.
We'll send you an email at 3:59.
I'll be sure to tap that answer. All right, everybody. Thank you very much.
Thanks, Jeff.
Take care. Carrie, thanks for that answer on absences. I think that really, I wanted to come back to that, and I think that really gives a nice full picture of what people can expect and hopefully reassure folks. Okay. And then there were 9. Any other questions? And what I was thinking was that, you know, we make a motion to accept the superintendent's recommendations. And if it seems appropriate, just to simplify things, because I did say I feel like the record of a meeting will include the recommendations, but I thought I would make an attempt to go through the highlights that, you know, would be critical for people to hear all together. And I would actually welcome people jumping in. If there's a major one I've missed, please add it. But I believe that we're going to be voting on a recommendation from the superintendent in response to the continued COVID-19 pandemic, that there will be masking of all students and staff K to 12 in our buildings and on all transportation, that there will be recommended masking for our pre-K students, that we will be implementing test and stay and exploring symptomatic testing, that we will continue to monitor and upgrade air filtration and ventilation in all of our buildings to ensure sufficient air exchanges, and that we will work with students and families on absences and makeup work. Does that feel right? Lori?
Yes, that feels right. I think that was a pretty complete list. I would just maybe add the clarification of duration of time, that the testing approval would be for the school year, the duration of the school year, and that the, you know, masking recommendations are at this time in accordance with the DESE recommendation through at least October 1st.
Would we say, I think the other items would be through the school year too, because most of those are things we would normally do. We would normally ensure proper ventilation, work with students on absences. So yeah. Thank you for that. Yeah, we do need to specify time, and I think that makes the most sense to line it up with DESE for the masking.
I will say, if,
oh, sorry, Chris, go ahead.
I was just gonna say, if I can just interject, because when you say it that way, right? When you say it the way that you just said it, it almost sounds like in any other year, we're not paying attention to the air exchange. And in any other year, we're not working with students who are absent, and we are. So that's why I didn't lead with those as our recommendations for mitigation strategies, because that is our best practice. That's what we do. What's different is we're going to talk about testing. What's different is that we're requiring the windows to stay on the buses, stay open on the buses, and we might be, we might keep windows open again longer throughout the school year than we would have, which can impact our heating costs, right? But the idea that we're going to maintain and regularly assess the air exchange and the air quality in the rooms, that's something we do all the time. And working with students who are absent and working with their, just working with students who are absent to re-engage them and to help them transition successfully back into school is something that we do regularly as well too. So when you said it that way, I just want to clarify that for the listening public, because someone could easily take that out of context and think that, you were saying, well, we're just doing that this year. Or maybe next year I could come up and say, nope, you just did it last year. I don't have to do it this year.
That's a great clarification. My inclusion of any of those things in that list is not an implication or indication that they wouldn't normally be done or we wouldn't continue to do that. It was more to encapsulate the discussion and reassure that they are front of mind as we enter this year. But I think you're absolutely right. The focus really is on the things that are not what we would normally do, which is the masking and the testing. So I think that's a great clarification. Alicia, you had your hand up prior. No, you're good. Valerie, did you have a final comment or question?
I support where we ended up. I think it feels right to specify to focus on masking and testing, because I mean, even though there was like a state mandate last year for masking, it's not that like bus windows was part of that, right? So like to get in the weeds too much feels counterproductive a bit.
Okay. With that, I would move that we accept the superintendent's recommendations as described for the start of the 21-22 school year.
Second.
Final comments or discussion? Okay, I'll call for the vote. Valerie?
Aye.
Catherine?
Aye.
Gloria?
Aye.
Sean?
Aye.
Alicia?
Aye.
And I'm an aye, so that's unanimous vote in favor of that. Thank you. Thank you, Dr. Chu. Thanks everyone who contributed to making that recommendation possible and for making it fit what Westford schools need to have a healthy and successful start to the year. And thanks
Thank you. Thank you, everyone. And we'll keep looking at this, because I think to one of the comments at the very beginning of the evening is, the concerns about, well, if all of a sudden the commissioner changes something on October 1st, are we going to be ready to just change? Are we then going to be saying, oh, well, now we need to investigate that? And that's not what we're talking about. I hope people understood that in the spirit of this conversation, that we are collecting our information in terms of our vaccination rates, and we're going to be looking at community spread. We're going to be looking at our case counts, so that we are then prepared to be able to make any changes if we feel that they are necessary at that time. We might feel, based on this information, that we shouldn't be making any changes, but we are going to continue to collect that information, and I'm going to share that information with you on a regular basis as we have our COVID update agenda item. Hopefully, I look forward to a day when we don't need to have it, but I think it needs to be there on our regular meetings while we have this, while you've given me the authority to do this.
Absolutely. And I think you highlight what I see as a big advantage of our approach, which is a flexibility and an agility to respond. I think the way we've set up our policy and this protocol lets us respond more quickly and effectively to things. And I know we've talked about on-ramps and off-ramps for things, and I know it was raised, in public comment. We had it raised in comment for the policy, and I've raised it. I mean, I've gone down that. I'm like, I think we need an off-ramp. I think we need data, but I think right now this is the right approach because we're still only a year into understanding this pandemic. And so God forbid in 10 years, if we're still dealing with COVID-19, we'll have a lot better idea of what metrics put in place. But by putting metrics in place right now, I think that would box us in a little bit. And if you get the wrong ones, it's difficult, and then we're not as agile. So I do think, trusting in our ability to consult multiple sources of data and expertise and recommendations gives us the best big picture outlook on ramps and off ramps. But we may decide otherwise going forward, but I feel like we're well situated now. Okay, thank you guys. Any other issues or questions before we, Gloria?
Yeah, it's just a quick one. I just really want to say thank you to the administration and the leadership team for all of the preparation that has gone into, making this a successful start to the school year. So excited to welcome back all of our students to the buildings this fall, and that for parents who are still listening and have concerns, I absolutely encourage you to read that FAQ document that is in our packet, and I'm sure is going to be disseminated. It's got a ton of information in it. We discussed a lot of it piecemeal here tonight, but it puts it all nicely in one location for you. And for parents who have any, ongoing concerns, reach out to your building principals. They're your first line of information if you have a particular problem addressed that is personal to your student or your family's needs, reach out to your building principals, because they're the ones that can really help you with that individual concern. We always love hearing from the public on school committee, but we can't help you address that specific family need or student need. Your building principal is going to be able to help you with that.
If I can just quickly remind everybody, to Gloria's point, that FAQ is on the website under the district news. We unpublished the old information because, Chris, you're right, there was information that was pointing us in different directions. And so right now, under district news, the FAQ is live there right now.
Great. Okay. I'll make a motion to adjourn.
Second.
With Valerie seconding it. She got to me first, at least here over on Koala Bear Lane. All right. Valerie.
Aye.
Catherine.
Aye.
Gloria.
Aye.
Sean.
Aye.
Alicia.
Aye.
And I'm an aye. That's us adjourned at 9:22. Thank you guys so much. It was a long one, but it was really. We will see everybody next Monday night. We do get to do it again, and look for the agenda coming out soon.